So welcome to an addendum to our fourth panel from Protect Our Province BC, which was entitled The Missing Voices, Stories from BC's Hospitals Front Lines. And we're so excited today to have Dr. David Forrest, who is an infectious disease doctor and ICU doctor from Nanaimo. He was available for us at our live presentation and then, of course, got called to work into the ICU, but we're so glad to have him here today on his Saturday post-call to answer a few questions. And just to remind folks of the context, people in BC aren't really aware of what's going on in the hospitals. And we are certainly hearing lots of stories and worrisome stories, I would say, about the state of our healthcare, and in particular that it's been worse since the pandemic began. We're hearing stories of people quitting and their mental health being very poor in healthcare workers, and nurses have published their own internal studies in BC. And so our thoughts were that if we could share these stories, if people knew what things were like, two things could happen. Folks might make different choices on the way they conduct themselves and the things they do during the pandemic. But maybe more importantly, and what we'll get to today a little bit more, is that perhaps there are other things that could be done. Maybe we need to get a little louder to make some good noise to see if we can make some changes, structural changes, things that can make a big difference in our healthcare system. So let's just start with you, Dr. Forrest. Can you tell me a little bit about what things are like right now at your hospital with respect to the pandemic, and maybe a bit about how things have changed?
Yeah, I think the first important message is that this fourth wave has not stopped. As I think many are aware, that this wave and previous waves have seen pockets of infection in various sites. There was a huge problem during the third wave, for example, in the Lower Mainland, particularly in the Fraser Health region, more recently in Interior Health. We've had a problem ongoing, obviously in the Northern Health Authority, which has been a major issue. And we've had actually, we're the hot spots on central Vancouver Island at the moment and continue to have a large number of cases every day. So certainly for us, both in terms of supporting other health authorities that have been overwhelmed, like the North, and in dealing with patients locally, we continue to have a significant burden of COVID disease in the hospital and in the ICU. I think what's important really to understand is that people who get sick with COVID, generally speaking, recover fairly quickly. But if they become seriously ill and require hospitalization, oftentimes, if they do not become critically ill, they're out of hospital in a few days. But if they do develop critical illness and respiratory failure, they're in the hospital generally for weeks. We're talking 4-6 weeks in the ICU before they even get to the ward, and then a period of several weeks there recovering. That is if they survive. And quite honestly, what we have seen is some fluctuation in the survival from this illness if people become critically ill over the pandemic. But, you know, unfortunately, what we're seeing more recently is that if people become critically ill with COVID and develop respiratory failure, their survival rate is not as good. Sometimes, I think, you know, we're sometimes somewhere around 30 to 50% mortality amongst those patients. So I think it's important to understand this is not something, if one becomes seriously ill, that recovers quickly. Takes a long time and therefore consumes a great many resources in the hospital. As a consequence, our ICUs continue to be essentially overwhelmed. You know, we're functioning, we're still maintaining capacity to admit, but it is exhausting. And I cannot tell you how impressed and grateful I am to our nursing staff and respiratory therapists and so on, who continue to work, and morale continues to be good despite an incredibly, frankly, excessive workload that's sustained. But you're absolutely right. People are done, and I think my fear is that once this epidemic wave or the pandemic settles down, that I think many nurses are going to be looking to do other work. They are exhausted. And I think it's also important to emphasize something that I think was raised by Sarah last week, that it's not just the workload that's problematic, it's the moral distress of not being able to do one's job properly that is really, really a problem, particularly for the nursing staff. So, and this has an impact, frankly, as you know, across the hospital. We've had so many sick calls and people and nurses that are exhausted. At one point last weekend, each of our wards had only one RN on it, on them, because people had called in sick. They're tired. And so this is a huge workload for staff. And I think many of these changes are going to be felt beyond the pandemic. The effect that this is going to have on enthusiasm for healthcare workers to continue working in acute care.
Yes. I'm wondering, have you heard, is there any plan, either locally in your hospital, your health authority, or from the Ministry of Health, to deal with exactly that problem, that nurses and doctors and respiratory therapists are exhausted, many have left, and those that are remaining are really just hanging on because it's the right thing to do, and if they leave, there's an even bigger hole and there's no one to fill it. I'm just wondering, what is the plan that you've heard that's going to help us through this?
I don't know, but I think that, like many of the things that you and I have talked about in terms of systemic issues that frankly COVID has uncovered, I think that this requires a rethink as to the incentives and supports that can be provided for healthcare workers. It's not just money. I think that there's many things. I know, for example, I think that our applications for critical care program have dropped off. I mean, I think that, so what are the things that we can do to attract people to enter nursing and the healthcare professions to do the hard work? And it's more than simply, as I say, money. I don't know, and I don't know whether the ministry has a plan and what that plan might be. But I think that looking at the way that healthcare workers do their jobs and what can be done to improve efficiency as well as relieve the workload, I don't know, but there needs to be significant reformation, I think.
Mm-hmm. It just sounds so overwhelming even to listen to it, thinking about one RN for, I don't know, 30 patients just doesn't sound like a good plan. And it's just unheard of to have people in an ICU for 4 to 6 weeks. I mean, before COVID, how often was that happening? And I'm thinking that must make it very difficult then to figure out how to admit people. I think what you said to me before was you don't even need to have an overwhelm in the number, but a steady trickle is enough to cause overwhelm at this point. It's like, I don't know, the dike, it's right at the very top. You don't need a wave, you just need a little bit too much. Is that kind of the sense of how things are in the hospital right now?
Yeah, I mean, in terms of the intensive care unit, that's exactly the problem, is that we have a steady stream filling a reservoir and really just a trickle going out. And that's the problem. Ordinarily, people who develop, for example, acute lung injury and lung failure oftentimes do require a long stay in the intensive care unit. But, that doesn't happen too frequently. The median length of stay is around 7 days or so. So in this cohort where the median length of stay is 20 or 30 days, it's the number of patients that keep accumulating, adding to that reservoir, and with nothing going out, that is a problem, because it blocks access to those critical care resources. It consumes the human resources to take care of them. That's what's different about the pandemic. It's just this steady stream of patients coming in. It only takes 2 or 3 a week that are going in and 0 to 1 that are going out for it to become overwhelming. And I think this is another concept that's not understood is that even as COVID spreads through the vaccinated population, we know that vaccines are 90% effective. That means they're 90% effective in preventing serious disease. But if 10% of the Canadian population becomes ill, vaccinated population becomes ill with COVID, and 1% of those require hospitalization, we're talking tens of thousands of people. That's going to overwhelm our system. So even if it's just a tiny percentage that become ill, the impact is huge when they come in, but they don't leave for weeks. And it just sucks up these resources and is going to have a huge impact on access. And the unfortunate thing is that as long as this continues at a steady stream, just a trickle coming in, that it's going to have a huge impact on our healthcare system for a long time yet.
Yeah, I saw yesterday in the government statistics that 22 fully vaccinated people in BC are in the ICU, not to mention the number of people hospitalized. And we see these numbers and we don't have a context, right? Like I don't work in a hospital. I don't understand exactly what it is about those numbers that what the meaning is to someone who knows how many beds they have and how many are full and how they're functioning. But I did have that sense yesterday that despite the excellent vaccine effectiveness, we still have ourselves a problem here. And we also still have thousands of lives that could be saved over the next 1 to 2 years through this pandemic. That's not even factoring in changes with variants, just at our current state of rate of vaccination. So maybe this is an unfair question for you, but I'll throw it out there anyway, because you are an infectious disease expert. You've seen everything firsthand. What are the kinds of things that you think people need to do to make a shift? Because even at our current rate, we could be heading for trouble, or we are in trouble. What are things that people could do or should be done? I know nobody put you in charge, but let's pretend. What are the kinds of things that might make a difference, really make a difference during this pandemic to preserve our hospital system and not have it overwhelmed?
Well, I think first and foremost, the most effective intervention is vaccination. I mean, truly, the vaccines are a miracle. I mean, I don't think there has been a vaccine, certainly not for a respiratory illness, that is effective as this, that was developed in as short a time span, and has such few side effects and consequences to its administration. And it is the number one intervention that is going to make a difference. There's absolutely no question that even though the antibody levels drop with time and it reduces the likelihood of preventing infection, so it still allows infection over time, it does decrease the likelihood that you'll become infected. And there's no question that is the number one most effective intervention. So getting vaccinated is the first thing. The second thing is masks are very effective. The reality is that this virus, it's quite clear that with the Delta, and I suspect the Omicron variant, these are highly transmissible. They're transmitted significantly by the aerosol route, by the airborne route, not by droplets. So physical distancing is less important than mask wearing, but mask wearing is critical, not because it protects the wearer, but it protects others from the person who's wearing the mask from distributing that aerosol. It's not perfect, but they are certainly very effective in reducing the generation of aerosol. So the second, I think, really important thing is mask wearing. And I honestly think that this is going to be a semi-permanent change, that we are going to be attending concerts and hockey games for years to come in masks. And this has been well accepted, as you know, since the SARS epidemic in Asian countries. So I can see this being a bit of a cultural shift, but I think that's an incredibly important intervention as well. And the last thing I think is that we need to advocate for changes in building codes to things like ventilation and so on, to improve or reduce the risk of aerosol transmission, not just of coronavirus, but of other viruses and so on, as well as avoiding overcrowding as much as possible.
Mm-hmm.
So, I think that we're coming into the holiday season. All of us are wanting to get together with families. I think there's still a risk to that, particularly if people are not vaccinated. And I think we just have to still be cautious. But the most important interventions by far that the public can follow are getting vaccinated and wearing masks.
Great. Thanks so much for your time. Excuse me. Thanks so much for your time today, Dr. Forrest. I think those are critically important messages. Getting vaccinated, wearing your mask, and as best you can avoid crowded indoor spaces, and advocating for better building codes and workplaces, et cetera, where we can have safe, clean air to breathe.
Yeah.
Great. Thanks so much. Have a great day.
Thank you. Take care now.